Agranulocytosis related to Clozapine by Tessa Passion, Shayla Mitchell, and Whitney Evans. Agranulocytosis. So granulocytes, also known as neutrophils, are white blood cells that make up part of a person's immune system. They contain enzymes that kill bacteria and break down substances that can possibly harm the body. Without these granulocytes, a person has a higher risk of developing frequent or chronic long-term infections. Agranulocytosis is a lack of those granulocytes. It is a condition in which the absolute neutrophil count is less than 100 neutrophils per microliter of blood, and normally there are at least 1,500 neutrophils per microliter of blood. So agranulocytosis is very serious and it can be life-threatening. If it is not treated, it often leads to death, most commonly through septicemia. It also occurs through all age groups as well as in all racial groups. It can be acquired, and that is more common among older people, and it can also be inherited, and that is more commonly seen in children.
What causes it? In the acquired form, either the bone marrow cannot produce enough stem cells that mature into granulocytes, or granulocytes are destroyed more quickly than they can be replaced. Chemotherapy, exposure to toxic substances, bone marrow failure, autoimmune diseases, use of prescription drugs. The congenital present at birth form of agranulocytosis is caused by a genetic or inherited abnormality. Signs and symptoms of agranulocytosis: sores in the mouth, throat, or gastrointestinal tract, chronic infection of the throat, gums, or skin, fever, chills, and a life-threatening drop in blood pressure, which may cause weakness or lightheadedness. Diagnosis and treatment. Agranulocytosis is diagnosed by a physician ordering a CBC test and determining the level of granulocytes present. If CBC results are not clear, a bone marrow biopsy may be ordered. In this scenario, treatment would be to stop taking clozapine immediately. Recovery usually occurs in 10 to 14 days, and a different medication may be prescribed.
Clozapine is a dibenzodiazepine derivative. It is an antipsychotic, second generation. It is indicated to treat severe schizophrenia that is unresponsive to standard drugs, or to reduce the risk of recurrent suicidal behavior in schizophrenic or schizoaffective disorders. The method of action: clozapine may produce antipsychotic effects by interfering with dopamine binding to dopamine, especially D4 receptors in the limbic region of the brain, and by antagonizing adrenergic, cholinergic, histaminic, or serotonergic receptors. An adverse reaction that is life-threatening is agranulocytosis. Some nursing consideration: you will monitor the patient closely with vitals and a weekly CBC, and you'll pay attention to the absolute neutrophil count. This will be completed weekly for the first 6 months of treatment and bi-weekly thereafter. Know the associated risks involved with clozapine. Patients will only receive a 1 to 2 week supply at a time, and prescriptions are refilled based on the ANC counts.